In this video, I review the effective therapies for post-traumatic stress disorder. Drawing from my clinical training, my in-depth review of the academic research, and my personal experiences getting prolonged exposure therapy and EMDR for my PTSD. I'm Milton Brown. I'm a clinical psychologist, and for 30 years I've focused on doing dialectical behavior therapy with people struggling with borderline personality disorder, self-injury, and trauma. I got my PhD from Dr. Marsha Linehan, who created DBT, and for many years I helped her with her pioneering therapy research studies. I was also trained at the National Center for Post-Traumatic Stress Disorder. For many years, I taught at the California School of Professional Psychology, and I run the DBT Center of San Diego. This video is a narration of my Psychology Today article on this topic. It covers the main trauma therapy approaches and how to get past a few common therapy obstacles. Here it is. I hope you find it useful.
Post-traumatic stress disorder, also known as PTSD, is a difficult long-term struggle in the aftermath of traumatic events. The American Psychological Association concludes that the most effective approaches for adults with PTSD are 7 specific cognitive behavioral therapies, including prolonged exposure therapy, cognitive processing therapy, eye movement desensitization, and reprocessing, also known as EMDR. Rigorous research studies show that, overall, slightly more than half of people recover from their PTSD after they complete 9 to 12 sessions of one of these trauma-focused psychotherapies. Choosing a specific therapy. You have several effective choices. Prolonged exposure therapy, cognitive processing therapy, and EMDR are the therapies that are easy to find and have strong research support for a wide variety of traumas. Because they are similar in effectiveness, you may want to start with whichever evidence-based therapy is the most available. Most patients with trauma do EMDR because it's much more available than the others. I found over 5,000 fully certified EMDR therapists in California, compared to only 27 certified in prolonged exposure therapy. EMDR is the most popular because many therapists believe it's the most gentle and effective, even though research does not support that belief. You can also choose a therapy based on your preferences and needs. Although the effective trauma therapies have a lot in common, they also differ in ways that may matter to you. All the top treatments have exposure, which involves helping you face your trauma memories repeatedly until you can better tolerate them. Most of them require you to thoroughly talk through the most challenging parts of your memories, although EMDR does not. Most of you write out your full trauma stories or repeat visual mental imagery of your memories. The therapies help you emotionally process your traumas, change your negative beliefs, stop avoiding reminders and safe situations, and reclaim or rebuild your life. Prolonged exposure provides the most structure for you to thoroughly remember your trauma events and stop avoiding safe situations that feel dangerous. What if your PTSD does not improve? Unfortunately, treatment failures are quite common when a specific therapist tries to do a specific therapy with a specific person with PTSD. Fortunately, you are likely to overcome your PTSD if you switch to one of the other therapies, if your first therapy is not helpful enough. You can also switch to a therapist with objectively more expertise rather than relying on their claims of success. Here are a few ways to find therapists with certification in prolonged exposure therapy, cognitive processing therapy, and EMDR. Complex trauma and complex PTSD are more challenging to treat. Complex trauma is when a person has had multiple traumatic events over long periods. Having complex PTSD means the person also struggles with other significant problems like addiction, rage, self-injury, suicide attempts, or borderline personality disorder. Overall, treatments are much less effective for people with complex trauma or complex PTs, DSDS, especially if their trauma started at a younger age. Suppose you have complex trauma and don't recover enough after 10 sessions focusing on your trauma memories. In that case, your therapist likely needs to provide more thorough exposures or do more to build your coping skills and block your avoidances. This idea is supported by a rigorous study that found that after EMDR, 67% of patients with complex trauma, mixed childhood and adult traumas, still had PTSD compared to 25% of patients who reported only adult trauma. Many patients with complex trauma likely need more exposure than what standard brief PTSD therapies provide. What if you have complex PTSD? Prolonged exposure is used to address severe complex PTSD within dialectical behavior therapy, or DBT. This new approach is called DBT-PE, and it's the most thorough approach for complex PTSD. DBT-PE begins by building up a broad set of skills for emotions and behaviors. After demonstrating skillful coping, the patient repeatedly tells their main trauma stories and acts opposite to their avoidant behaviors. In a 2014 study, 13 sessions of prolonged exposure were added to a full year of twice per week outpatient DBT. Many of the patients had struggled with self-injury and suicide attempts before starting the treatment. Adding prolonged exposure to DBT improved the PTSD recovery rate to 80%, compared to 40% among patients who got standard DBT without prolonged exposure, and cut suicide attempts in half. If you have complex PTSD, I recommend you enroll in an adherent DBT program that provides DBT-PE, which includes 2 weekly DBT sessions and 24/7 skills coaching between sessions. Can you tolerate trauma therapy? Despite the reputation that prolonged exposure re-traumatizes patients, all the trauma therapies are equally tolerated by patients. They have similar dropout rates, about 18%. Skilled therapists thoroughly prepare you and adjust the pace as needed. You start by writing about what happened to you, talking through it, or silently bringing memories into your mind. You also can start with your least distressing memory and slowly work your way up to the more difficult ones. Never start distressing therapy tasks if you feel confused or pressured. EMDR is the least directive, emphasizing natural pacing above all else. You flexibly flow through your trauma processing as you attend to your inner experiences and move freely back and forth between various difficult life experiences in the past and present. EMDR also reduces the emotional intensity of every exposure by having you engage in a distracting task, usually alternating eye movements, sounds, or touches, while thinking about your traumatic experiences. If you don't improve enough after 10 sessions of this lower intensity exposure in EMDR, your therapist likely needs to be much more directive. Many patients with complex trauma need more exposure than what standard EMDR provides. A 2007 study by Bessel van der Kolk found that 67% still had PTSD after 8 weeks of EMDR. The other trauma therapies also do more to discourage avoidance of trauma memories and safe situations that feel dangerous, and avoidance interferes with trauma recovery. Switching to one of these other trauma therapies can make your therapy more uncomfortable than you would prefer, but it's so worth it to finally recover from your complex trauma. Whenever you decide to embark on your trauma therapy journey, I applaud your courage. If you're a therapist, here are resources for getting trained and certified in these approaches. The following videos show you more about the therapies we just reviewed. Click on the video links in the upper right corner of your screen.